Well, drug abuse is on the rise here in the U.S., but it's not illegal drugs that pose the biggest threat.
It may very well be what's already in your medicine cabinet that's putting you and perhaps your child's life at risk. Dr. Vincent Eletto is our medical expert, and you work in the ER. What are you seeing?
Oh, we're seeing a lot of overdoses, a lot more overdoses than we used to. In fact, we have a 160% increase in overdoses from the abuse of prescription painkillers.
Say that number again?
160% increase. That's more than the combined cocaine and heroin overdoses. Yeah, these deaths are tragic.
And is there an age group that's associated with this increase?
It's happening more and more frequently among young kids. They say that about the age of 12 now, children are experimenting with
12?
it. 12.
At 12.
1 in 4 students will use prescription drugs, abuse them, before they graduate from high school even.
Wow.
What kind of drugs are we talking about? Are they raiding their parents' cabinet? Are they downing cough syrup or something else?
No, they'll go right into the medicine cabinet and they'll get the Ritalin, they'll get the Percocets, they'll get the Vicodins. And what they do is they have parties. They get it and they put it into a bowl and everyone goes by and they choose what they want by the color, the attractiveness of it. And here's the problem is that they're immortal. We've all been young. We all know that we can't die when we're that young. So they take 1 pill of this, 1 of that, and these are not just additive effects. It's what we call synergy, so that 1 and 1 doesn't equal 2, 1 and 1 equals 5.
Right.
The potency is that much more elevated, and this is where they run into trouble.
Wow. You know, it's interesting. We had a popular commercial come out about 1.5 years ago where there's a drug dealer standing on the corner saying he's out of business because the kids are getting the drugs from their parents.
That's very true.
And you're seeing the result of that.
Is about 60% of all these drugs that are obtained illicitly are obtained from friends, relatives, people who want to be helpful and say, oh, take some of this, it'll help.
Well, let me ask you something. What's the root of the problem? Are parents too quick to go? Are doctors too quick to prescribe? Are parents not throwing away their prescriptions when they're done with perhaps a medical procedure and they've got some painkillers and they forget to throw them away?
Oftentimes, people are often just very relaxed about it. They just leave the prescription out. They leave the medication out. And truthfully, if you have 15, 17 pills, who's going to miss 3 or 4? Right. You're not going to keep track of that.
Let me flip it around. I didn't mean to interrupt you there, Brian.
No, go ahead.
But I'm going to flip it around. There are many young people who are on medication, whether it's Ritalin or what have you, and I've heard that sometimes parents will take their kids' medication and get a high. Is that a myth?
Absolutely, because everyone, mother's little helper, everyone needs a little helper.
Oh, I've heard of that, mommy's little helper, mommy's little helper.
So yeah, if you take Ritalin, it's a stimulant, it helps you get through the day.
So how do you manage this? I mean, we're talking about something happens in the household. You can't really legislate it. How do you as a physician, manage who's taking the medication and how much you're doling out?
As a physician, there's actually specialties, subspecialties, pain management specialties, and that's what they are trained in, to control the pain while carrying on your activities of daily living. In other words, you keep a relationship going, you keep your job, and that's who actually should be doing this type of pain control.
We're talking about like a functioning alcoholic type of scenario?
Yeah, you're talking about someone who can actually carry on their daily life. People are living longer now, they're living with more disease. Baby boomers are out there, they're older, they've got arthritic conditions, they've been through multiple accidents, and they do need pain management.
Well, this has got to be hard to monitor because people can go to different doctors for different ailments and take things to different pharmacies, and you could be getting all kinds of different prescriptions and then become addicted to that, which kind of leads me to what's the difference between dependent and addicted?
Okay, tolerance is something that you build.
Right, tolerance.
And it's what happens is you need more of that drug to reach the desired effect. But a drug addict is someone who he seeks drugs. He lives for that drug, no matter how dysfunctional, has no relationships, has no job. Big distinction between the two. It's something that one must talk to their doctors. They must feel comfortable about it. Prescription drugs are good as long as they're used properly, the way they were meant to be used.
Let me take you in a different direction in following up on that. Now we see the digitization of medical records. does that perhaps give you as physicians a better way to manage this?
Oh,
so,
yes.
So in other words, somebody can't go to 2 or 3 other doctors to get that same prescription.
Right. What the government did was they started these programs, prescription monitoring drug programs. And so everything is going to be digitalized, like you said, and red flags will come up. We keep track of people who are at high risk. We keep track of the doctor shoppers, as you call them, and the pill mills, which is really important. The low percentage of docs who are out there actually just writing scripts.
As we wrap it up, best advice, if you have to have pain medication, best advice on what to do to prevent your kids from getting into this, and also from, to protect yourself as well.
Lock it up.
Lock it up. It's that simple.
Keep it out of everyone else's reach, and use that drug only as prescribed by your physician. Talk to him. If you find that you're taking the drug more often, you're taking a higher quantity, then we're looking at a possible addiction, and you really should be honest with your physician. We are non-judgmental. We will help you get into one of the programs if we need to, which incidentally has seen a 321% increase in the last year.
Wow, that's incredible.
Doctor, we appreciate your medical advice.
As always,
Thank you.
Insightful.
Thank you.
Thank you.